I'm Doris Grinspun, the CEO of the Registered Nurses Association of Ontario, who represents registered nurses, nurse practitioners, and nursing students in the province of Ontario, Canada. And I was thrilled to be invited to speak, to do a plenary at Wounds Canada at their conference here in London. Very impressed with the huge attendance of people, with the energy in the room, with the engagement and obvious active attention of people, not only during my talk, but also throughout the conference. Very, very happy that I was asked to speak about becoming a health advocate. As health professionals, we have a responsibility to be health advocates, and we also have a responsibility, of course, to be evidence-based, outstanding practitioners. At the foundation of it is to be first and most importantly, practitioners that serve clients, serve the public, whether it is at home, in their own environment, or in a hospital, or in primary care, or in public health, or in rehabilitation. Is really to serve them to the best of our abilities, and that must include serving them with the most relevant and up-to-date evidence, and not based on whatever we were trained whenever, or whatever we think is the best way of doing things. Equally important is the area of health policy, because while as individual practitioners or groups of practice, if we work in interprofessional teams, we provide excellent care based on evidence to individuals and to groups of people, you don't change the world through individual practice. You change one patient at a time's life, and that's very important, but we shouldn't stop there. The next piece to augment alongside with that is for each one of us to become health advocates. And for that, we need to intersect evidence-based practice and evidence-based policy to ensure that we push forward healthy public policy for the public in Ontario, in Canada, and across the world. In Canada, we pride ourselves that we have a universal health system, and that is true. That's what brought me and our family here to Canada. That's what brought many of you, and that's what every Canadian prides about. That does not mean that there are areas that require improvement. Evidence-based practice is one of them, and evidence-based policy for furthering universal coverage is the other one. The perfect example for Wounds Canada was our joint success of Wounds Canada and RNAO and others that we brought on board to push forward the issue of universal coverage for offloading devices. Offloading devices, believe it or not, that cost between $100 and $1,500. $100 for patients that have infected wounds, and it's one type of device. $1,500 all the way to $1,500 for patients that don't have infected wounds. But that's what it costs. That's the range, as compared to $70,000 that is an amputation, let alone the suffering that is for a person and their family and their lost work days, the social cost that it has for the person, the family, and society to live with an amputation. That we needed to fight. So universal coverage for an amputation is covered. Offloading devices in this country of ours is not covered. Ontario is the first jurisdiction that, thanks to the collaboration between Wounds Canada, RNAO, and others that came on board and helped by the tremendous understanding of Dr. Eric Hoskins, who was the Minister of Health at the time, that is now covered in Ontario and will serve, no doubt, to the rest of the world. Do we stop there? No, we don't stop there. Offloading devices is part of a comprehensive program that is necessary to save limbs. So limb salvages clinics are essential for that, and that involves offloading devices, but of course involves way more than that, and that's where we need to go next. And RNAO is ready to put its political policy acumen, evidence-based practice acumen behind to work together with Wound Canada and others to push the full agenda now.